Hello, World History. This video is for those of you who are doing the topic about the WHO, the World Health Organization, and pandemics. And we're going to look at a historic example of the World Health Organization eradicating smallpox in the 1970s. And we're going to use that toward our understanding of the role of the WHO, the World Health Organization, in fighting the current pandemic of coronavirus. And so where you're going to get, I gave you this video about the WHO and smallpox. And then you've got this, which is you'll write an editorial. It's your final project. And first you're going to research the historic event. That's what you're doing today in that video. And also I'm going to share my notes with you where you're going to define the event, write the causes, course, and effects, and lessons learned about the eradication of smallpox. And then tomorrow you're going to briefly research the current event that'll have to do with the World Health Organization and coronavirus. You'll state the problem, and then you will share your thoughts about how the event from the past can guide our thinking about the present problem. Now, you're not going to solve the coronavirus problem, but you're going to provide insight and reasoning using this historic example of the WHO in the 1970s. And so today we're going to do the research topic. You're going to write World Health Organization and pandemics. Okay, World Health Organization and pandemics. In historic example, you're going to write World Health Organization eradication of smallpox. And we're going to get the cause, course, effects, lessons learned. So you're going to write World Health Organization eradication. That means the destruction, the erasure of smallpox. And so we're going to see what it did. Basically, because of targeted communication, surveillance, being able to watch for the disease, and then containing the disease, they were able to contain and destroy it. And it went from, in 1970, 10 million cases a year, and 2 million, instead of 2 million cases, I meant 2 million deaths. 2 million people dying a year in 1970, to 10 years later, zero. Literally from 10 million to zero cases. The effects of this is that smallpox was eradicated in 1980. Millions of lives were saved. And since then, the WHO, the World Health Organization, coordinates efforts to combat disease such as HIV/AIDS, SARS, Ebola, Zika, and now coronavirus. And still these others. Just because we're dealing with coronavirus now doesn't mean these other diseases have gone away. It relies on different nations' contributions. And so looking at it in a big picture, what is the World Health Organization? Its purpose is international public health. And a background on smallpox and the WHO. Going back to smallpox, this virus, if you remember, it killed, when we did our unit in the first semester, killed 8 million plus Native Americans. The exact number isn't known, but wiped out the population, a global killer, and would affect people, would kill and maim many millions of people, including Queen Elizabeth of England. Her face was pockmarked from the pox. We also saw that in the late 1780s, Dr. Edward Jenner, Jenner who did something good for the world, was able to create a vaccine, the first vaccine using cowpox, injecting people, actually children with it, as test subjects in early industrial England, and finding a vaccine. However, the vaccine was not widely given, and so smallpox continued to kill up until 1970, close to 2 million people a year and 10 million cases. So how this, again, is not a problem that smallpox doesn't respect borders. It's not, doesn't just kill people of one nationality. Viruses are international. And so finally, after World War II, you have an international group that's formed, the United Nations. And one of the early one of the parts of the UN is called the WHO. It is part of the United Nations. It's the World Health Organization. It was created in 1948. In 1958, the Soviets proposed eradicating smallpox. And again, during this time, during the Cold War, Soviets and Americans were arch rivals. Yet the Americans said, okay, we will lead this charge, and they did. The U.S. Center for Disease Control, the CDC, sent one of their top scientists to lead the WHO's eradication of smallpox. And it was happening in nations, especially that had high poverty, were vulnerable to disease. And in the video, you'd see that it's in Brazil, in Africa, and in India especially. And they were able to destroy it by, as you saw in the video, they had a vaccine, and then they were able to target it. And so what are, based on what we said right there, watch the video. The video is great. What are some of the lessons learned? Well, intelligence, goodwill, and cooperation of the world achieved through this organization, the WHO. You're able to get the best scientists, and virologists, and public health administrators are able to cooperate and destroy this disease that especially affects impoverished people. And international problems, a lesson we can learn from it, international problems require international solutions and scientific leadership, and also American support. And so in this case, why would I say American support? Is that because I'm a nationalist? Well, it's because the United States is one of the wealthiest countries in the world and centers of technological progress. We have the capacity to lead and to solve problems. And it's something that we've done as a country, whether it's the moon landing, whether it's the D-Day invasion, whether it is pretty much the the creation of technology. America, the United States has a significant role to play in with organizations like this, because an international organization requires the cooperation of all nations. And so we'll see that in our current problem of coronavirus. The World Health Organization does not necessarily have all of the nations cooperating in the way that they need to in order to have another victory like they did, like we all did against smallpox in 1980. So while the World Health Organization has the potential to destroy or even eradicate or contain a disease, it requires the cooperation, goodwill, and intelligence of all nations around the world. Okay, so that has to do with the course, the causes, the effects, and some of the lessons of the World Health Organization's relationship with pandemics. All right.